Welcome to this special conversation on Alzheimer's disease. We'll be discussing the latest in treatment, understanding the cause of the disease, and also take a look at the research that's going on right here in the Capital Region. I'm certified health coach Benita Zahn. More than 6 million Americans are living with Alzheimer's disease, and according to the Alzheimer's Association, that number is expected to grow to nearly 13 million people by 2050. And women are more often affected than men. So how to tame this scourge? Well, that's been the work of Dr. Richard Holub, a neurologist for more than 35 years. Dr. Holub is the principal investigator for the research division of the Alzheimer's Disease Research Center on Madison Avenue in Albany. Good to have you with us. It's a great opportunity to have this conversation. So, Dr. Holub, let's just get started with a snapshot of the work.
Well, as you mentioned, for the past 35 years, I've been engaged in Alzheimer's disease research, and over that time I've had the privilege to participate in over 125 national and international research programs moving towards the development of treatments for Alzheimer's disease. And in that time, we've had 7 medications become approved by the FDA that we've worked with, and additionally, we were highly involved in the development of the first amyloid Alzheimer's imaging agent. It's been quite a run, but we're still in the middle of it.
When you started this work 35 years ago, could you imagine to have reached this point?
Not at all. We wanted to reach this point, but we had very little information to go on. Every year we've learned more and more. And we've also found that many times when we thought we were making advances, Alzheimer's disease would laugh at us and we would have a setback. But we're now quite at the point where we finally know we're going to tame this disease. We've reached that point.
You mentioned that your work is not only in the States, but also international. You have collaborated with the New York Academy of Science and the Global CEO Initiative on Alzheimer's disease. What is that, and how does it fuel your work?
Well, there's been a perceived great need on many important organizations and individuals that, although we're very pleased with the progress we made and have made, we're very anxious to move the needle faster. How do you accelerate Alzheimer's disease research? And that's where this collaborative between the New York Academy of Sciences begins. And they have developed a system where they're working with national and international research organizations like ourselves to advance and accelerate Alzheimer's disease research. In 2016, they invited me as one of 44 research investigators to lead the charge, and it's been a great ride, a lot of fun. I'm thrilled to be part of it.
Clearly that supports the work that you're doing.
Absolutely.
Right here in Albany. And for those who would be interested, what makes somebody eligible for your programs?
First of all, most of our programs now involve people who do have complaints about memory difficulties. They may have some observations from their family members, from themselves. They may be a bit forgetful. They may have some memory glitches. They may have some word-finding difficulties. They might be have a little more difficulty with their checkbook, or maybe their sense of direction's off, or maybe when they're looking for something, they find it's harder to find and realize later it was right in front of them. And so even though these are very mild symptoms, these folks do come in to be evaluated for the possibility that this may represent the earliest signs of Alzheimer's disease.
You and I have had an opportunity to chat, and you said a diagnosis of early Alzheimer's disease is not early the way most folks would think of.
That's true. We've learned only recently that Alzheimer's disease begins 10, 20, or even 30 years before an individual has any symptoms. And therefore, when a patient or an individual comes to us with a concern, however mild, it's really not early. This has been something that's been incubating for a long time, and that is what has led us in most of our programs to look for individuals who are interested in being patient volunteers who have the very earliest of symptoms, half of whom might still be working.
So rather than those who are severely affected, which is how we often think about somebody with Alzheimer's disease. We're going to take a closer look at that. Also, what we know today about the causes of Alzheimer's disease when we come back.
Dr. Hollop is an amazing guy, and what I liked about him was he wants to know what causes it and how to keep you from getting worse. He's got an amazing staff. They're all friendly, especially Dr. Hollop himself. You know, he's dedicated to finding a cure for the disease.
I'm Dr. Richard Hollop here at the Alzheimer's Disease Research Center. The earlier people come, the better. Come in for a no-cost memory screening. You'll be glad you did.
And welcome back. We've been talking about how research has progressed through the years, the 35 years that Dr. Hollop has been researching Alzheimer's disease. So, Dr. Hollop, what do we know today about the cause of Alzheimer's disease? Because it's changed in recent years.
We've learned a lot. We have a very good idea, a sketch of the cause of Alzheimer's disease and its development over time, but there's still a lot of questions. We do know that we do not have Alzheimer's disease unless we have an accumulation of a misfolded protein in the brain called beta amyloid. We're not quite sure why the beta amyloid begins to build up in the brain. It misfolds, it aggregates to itself, it forms clumps and plaques in the brain, and we know that that's necessary to develop Alzheimer's disease. We are now beginning to find that we believe that the increase in amyloid is triggered by inflammation that comes with normal aging, inflammation that comes with other conditions and diseases. And so we have many of our programs are focused on inflammation. After the inflammation begins the accumulation of amyloid, it cooks, it incubates for 10, 20, 30 years, and at some point it triggers a second protein called tau to begin to misfold. And once the tau protein starts misfolding, that's when patients often begin to experience their first symptoms of memory glitches, word finding, etc.
So let me ask, in the research, is it the amyloid and preventing the accumulation of that, or is it focused on tau and tamping that down or turning it off so it doesn't then interact with amyloid to create the problem of Alzheimer's?
Well, our first foray into looking for treatments for Alzheimer's disease was focused on what we knew the best, which was amyloid. And amyloid is an easier target to develop potential treatments for. And so our earliest efforts and current efforts are focused on amyloid. It's more difficult to develop treatments for tau, and so we've only just recently begun to have programs directed towards tau, since that leads the symptoms that the patients experience. So we're doing research very deeply in both areas, as well as in inflammation.
Testing for amyloid, is that in the ready for prime time or still in the research phase?
Well, we're very pleased that it's at least available in the early stages in research. Early on, some of the research programs we were engaged with did not have any biomarker laboratory testing, and so we would estimate that the patient had Alzheimer's disease because they met all of the criteria, and we found out later that a third of those patients actually didn't have Alzheimer's disease, and that was why we were having difficulties identifying treatments early on. We have now developed, as I said earlier, an Alzheimer's disease PET imaging agent, and we actually have several of them now, and we also have developed blood tests. We have 3 different blood tests available in research, not in clinical practice. Can't go to your doctor and ask for it, not yet, but soon. So we're getting very close to making these available to the general public.
Because there was a period of time where people really were never confirmed to have Alzheimer's until post-mortem, after their death.
Exactly. And yeah, our goal here is to eventually have these blood tests available to the primary care physician, and people will go for their annual physical, and they'll get their regular blood work and they'll get their Alzheimer blood work. And if it's positive and the person is 100% normal, the doctor will say, you know, you're 100% normal, but you have early Alzheimer's disease. We're going to give you a treatment.
So that it won't progress, ideally.
Right, and so that it may be they never have a symptom. That's the goal.
And it's a wonderful goal. You mentioned inflammation. We have other disease processes. You know, when people have belly fat, that's inflammatory fat, and it raises the risk for heart disease, for diabetes. Do we see a connection with folks who have those diagnoses and Alzheimer's?
Yeah, absolutely. Diabetes is associated with increased inflammation, particularly if the hemoglobin A1C is above the number 7. And that does increase the risk of Alzheimer's disease, for sure. Inadvertently, a medication used for the treatment of diabetes, they're called GLP-1 agonists. Another name is semaglutide. There are 5 on the market. And inadvertently, following those patients in their diabetic treatment, we have found that they end up having a reduced development of Alzheimer's disease.
Fascinating, and those are also the drugs that are being used to help people shed excess pounds. There's so much work that's going on. So we'll take a quick break, and when we come back, we'll take a closer look at some of the research programs that Dr. Holub's involved in.
I stopped working for about 3 years and was looking for a solution, some way of getting better. After treatments, I've gone back to work and I've started to work on my car. If you have some memory problems, you have nothing to lose. Dr. Holub is an amazing guy. He's dedicated to finding a cure for the disease.
I'm Dr. Richard Holub here at the Alzheimer's Disease Research Center. Come in for a no-cost memory screening today.
And welcome back. Before we took our short break, we were talking about getting further information on the research programs that Dr. Holub has going on at the Alzheimer's Disease Research Center. So the floor is yours.
Okay, well, thank you. As we've learned more and more about Alzheimer's disease, we've been able to expand the search for treatments which affect the course of the disease at multiple different spots in the disease progression. As I mentioned earlier, we have multiple research programs directed towards the removal of the amyloid protein. We have a program that prevents the amyloid protein from aggregating and causing plaques. We've also have several programs that are against the tau protein. We have one significant program which is an anti-tau antibody made in the lab and then given to patients, a lot like the immune treatments we get to prevent the flu, etc., COVID.
But let me jump in. Are we talking about a vaccine per se? Because flu
Yes.
is considered a vaccine.
Yes, thank you. These are vaccines that are given and directed against the tau protein to reduce the toxic tau protein. Also, we have a space-age program where we're directing treatment to inactivate the production of the tau protein. DNA makes RNA, RNA makes proteins. And this particular treatment inactivates some of the RNA so that the toxic tau protein is not generated.
Because probably we've come through the COVID era, people better understand, you know, a phase 3 study, which is far along the road from a phase 1. Phase 1 is, let's take a look. Phase 3 is it's, you know, we know it's pretty safe, but how safe and how much to give. The things you've been talking about, where on the spectrum are we?
The amyloid programs are primarily phase 3, some phase 2. The tau programs are primarily phase 2. They're a little earlier. They've come along a little bit later. And phase 3 is at the point that if those programs are successful, then the drugs will be approved. So we're pretty far along.
There's a genetic component in some cases with Alzheimer's, the APOE4 gene. And if you get one from mom and one from dad, the risk is darn tootin' high.
Yes, there's a protein in the body, in the blood, and in the brain called apolipoprotein E. I know that's a bit of a mouthful. And it carries cholesterol and fats in the blood, but in the brain it's very important as a repair factor. And there are three kinds in humans. One is an E2, ApoE2, which is protective against Alzheimer's disease, good repair protein. The next is ApoE3, which is the most common. That's an average repair protein. And the third is ApoE4, and it's a poor brain repair protein. Even if you have one, say from your dad, you have an increased risk of Alzheimer's disease. If you have two, that, as you said, one from your dad and one from your mom, you have a much higher increased risk for Alzheimer's disease. We check that in all the patients who come in to be evaluated with a potential interest in research. So when they come in just for a screening visit, we do check that and are able to give them the counseling associated with the discussion of those results.
Is there any research going on, whether in your program or elsewhere, looking at editing those genes?
There is some early research, I'll call it almost before phase 1, and that's been going on for some time. There is a research program that we've been involved with to support the program where people have two of the E4 high-risk genes, and while they're not repairing those proteins, the program involves introducing into the spinal space the DNA that makes the E2 protective protein. And the goal is to replace the E2 protective protein sufficient that it balances off the E4 risk protein.
Very exciting work.
So
Very
it's
exciting.
moving along.
Yeah. And when we return, we're going to share the story of a man whose life has been changed by early intervention, just what Dr. Holub was talking about. Stay with us. We'll see you in a moment.
I'm Dr. Richard Holub here at the Alzheimer's Disease Research Center, where I have been for the past 35 years. I've spent my entire career dedicated to the development of treatments for Alzheimer's disease. The earlier people come in and become involved, the better, whether they are younger or whether they are older. You can start your personal journey by giving us a phone call, checking us out on the website, and by coming in for a no-cost memory screening.
We've been talking a lot with Dr. Holub about the work going on at the Alzheimer's Disease Research Center. So what happens when someone knocks on the door, meets with the doctor, and then is enrolled in one of the research projects? To learn more about that, here's the story about a local man and his personal journey.
I was kind of having trouble concentrating and not remembering how to do things I've done all my life. And it wasn't always that way. It would be some days I would be fine and other days I wouldn't be. That was the start of it. I also saw that in my work. I would have a job and I'd get near the end and I'd have a lot of difficulty trying to finish it. That was one of the biggest things I saw, was my ability to have real good concentration. I stopped working completely, even out of my business, for about 3 years. I did very little of anything and was looking for a solution, some way of getting better. I got in clinical research for a number of reasons. One is my mom was in an Alzheimer's unit for 13 years. I didn't want that to happen to me, and it really made me be proactive to seek whatever medications and help I could get. It's not a bad thing for you to say that you're having some problems. Just like somebody might have cancer, if you have some memory problems, it's a normal thing to have to admit to, and you can't be afraid to do that. You need to seek help. Dr. Holub is an amazing guy. He's got an amazing staff. They're all friendly. and I've never been afraid to go there or be intimidated. The research and seeing Dr. Hull with the medications, I was able to do the things that I hadn't done for many years, especially being able to concentrate. You have nothing to lose. The office is extremely friendly. They'll accommodate you in any way they can. So it made it very easy for me to be able to stay there and go through the research. But it also gives me relief, and I'm still working.
Well, that's quite an inspirational story and really a testament to the work that you're doing and where we are with research now. So I'm going to ask you now to pick up the story as if somebody walks in the next time.
Yes, if somebody has a concern or an interest in finding out more about some symptoms they might be experiencing and they come in, the first thing they'll do is, of course, they'll call and there'll be a little bit of a telephone intake and they'll be given an appointment to come in for screening at no cost. And we'll take a medical history, we'll give them some cognitive testing. If there are still some symptoms more than we would have thought, they'll get some genetic testing at no cost if they wish, the results of which will have to be discussed at a subsequent visit. And at that point, if they express interest in research and their cognitive testing is scored, then we'll show them the programs that they might qualify for. Everybody has a different concept in the back of their mind of what research might be, and since the programs vary a great deal in terms of the requirements of the patient, each study requires a study partner as well as the patient, and so there has to be a family member, friend, neighbor, someone who will come in with them at their various visits.
What if somebody doesn't like needles? Is everything about injections or drips?
Yeah, now, believe it or not, we do have some programs with old-fashioned pills, and we even have a program for patients with no injections, no infusions, and no pills. It is a program that provides visual and auditory stimulation. Looks a lot like virtual reality. They do it 1 hour a day, and it's designed to increase the gamma wave activity in the brain, which is associated with improvement. The early research shows that this actually makes a difference, and now we're doing a program expanding it to a larger number of patients. So we do have those people who come in, I don't want a pill, I don't want a shot, I don't want an infusion, and this is the program for them.
You know, folks talk about a cure. We're not at a cure yet. But you can do some really, the work you're doing is available, some really important things in terms of slowing progression.
Absolutely.
And that's why someone with early symptoms should be coming through the door.
The important goal that we're all striving for is to eventually prevent this disease. But right now, our programs are directed towards the first goal would be to slow progression. If we do better than that, the second goal would be to provide stability. And if we do even better than that, we'd like to have some improvement. But the real goal, the real long-term goal, is to prevent the disease from happening in the first place.
You mentioned that if there's genetic testing, there's no cost. Is there any cost to any of the work that you're doing with patients?
No, all of the work we do is grant supported. There are no fees of any kind to any study-related testing.
And in terms of who will be cured, will they be in the program? Is that where we're going to find it?
Well, it's pretty clear that the first person to be cured from Alzheimer's disease will be in a clinical trial. No doubt about that.
And the medications that we hear touted in the news, where do those stand right now in terms of efficacy?
It's early days. We're building out the infrastructure now to provide these treatments, but they also have some risk. The research has shown that at least one of these drugs does slow progression by about 27%, not 100%, and they do bear some risk. So it's early days.
And the people who come in and are involved in your study, what kind of a time commitment in terms of days, months, years do they sign on for?
Yeah, that's part of the job of selecting a right program, because the programs vary a great deal. Some of our programs, people will come in once every 3 months, usually for a year, year and a half. Other programs, they might come in once a month. We've had one program, only one, for a long period of time where people come in every other week. So it depends on the individual, their time availability, the availability of their study partner, and what makes sense from their perception of what they're willing to do in terms of being involved with research.
And do you have to live in the capital region?
No. We have a wide berth that we cover. We always have 1 or 2 people coming from Rochester, Binghamton. A couple summers ago, we had 2 people coming from Canada. And these are people who research the programs we have. They identified one they wanted. They couldn't get it close, and so they come to our location.
So the takeaway really is the earlier you get the diagnosis, the better your chances for slowing the progression of the disease.
Absolutely. In fact, most of our programs are looking for people with very early symptoms, usually beginning in their 50s and older.
And those who may still be at work?
Those who may still be at work, and those who may think of themselves not necessarily as a research candidate, but do have some early symptoms.
And maybe they don't recognize it, but their friends and loved ones do.
Almost always. The information is right here on the screen. If someone is interested in a memory screening at no cost, they shouldn't hesitate to contact us. They can call our office at 518-426-0575, or they can visit our website at alzheimersresearchcenteralbany.com. Remember what your grandmother said, the early bird catches the worm.
And there's so much for so many right now. Dr. Holub, thank you so much for sharing this important work and this very encouraging work as well. So we'll keep tabs on it. Thank you. And thank you all for joining us. I'm Benita Zahn. Take care.
Dr. Holub is an amazing guy, and what I liked about him was he wants to know what causes it and how to keep you from getting worse. He's got an amazing staff. They're all friendly, especially Dr. Holub himself. You know, he's dedicated to finding a cure for the disease.
I'm Dr. Richard Holub here at the Alzheimer's Disease Research Center. The earlier people come, the better. Come in for a no-cost memory screening today.